Alison Tonge. I'm Exec Director of Strategy, Innovation and Planning, and I would love to share 3 steps for connected resource management. In the past, resource planning and management often meant by department with separate plans for finance, workforce ops, rolling up into an organisation level, and the data wasn't related either between those departments or across the professional teams of finance, HR, ops, etc. And leaders often complained of inefficient planning processes and potentially unconnected decision making, and most importantly, lack of visibility on how one decision impacted on another, and therefore how resources are being used to achieve key performance results, operational productivity, efficiency, and how those decisions relate to populations and places in a transparent way. So how can we improve on this approach and look to the future? I'd like to share 3 steps, being first to design, inspire and measure for key strategic results. Secondly, to sort the messy data middle out. And thirdly, create dynamic assurance. So in designing our planning models and designing our connected planning approach, we need to ensure that we're designing to meet our strategy. And many strategies have these 3 core objectives, which is improving population health and well-being, improving sustainability and use of resources, and improving quality of services. And decisions are at the heart of that, and good decision making. And when we're making those decisions, and therefore how we are planning for those decisions, we tend to look across 4 different lenses. The first being decisions that go either bottom up or top down from a region, an organisational board to a department, across multiple organisations and teams, across a pathway and a process, for a place, a geography and a community, or for a population type and a population segment with a particular need. And we're connecting these decisions and connecting these lenses by looking at different resource elements. We're looking at how our activity coming through to our organisations links with workforce through the lens of productivity, how our innovation and transformation programs impact on the resource lenses of finance, workforce, impact on performance. And therefore we're looking in our design principles about the what, the who for, and the how across a 3-year time period or longer term time period, a 1-year planning horizon and a monthly planning horizon. So those are the key design principles for a connected planning solution. We want to ensure that when we are connecting our planning, that we're looking to deliver the right outcomes and benefits for our organisation, our service, for our population and for our place. And in this regard, we should look at multiple benefits for all of the interventions we have and we're planning to deliver, whether they be social value interventions, care delivery interventions. What is the impact and what's the benefits that are being created? And therefore, our planning solution should embed right across all of our initiatives this lens of benefit realisation. Empowering benefit realisation through innovation and systemising innovation into our planning process. So it's a continuous cycle of identifying initiatives, looking for new value realisation, looking for new innovation that empowers workers, patients and partners. Secondly, in our 3-step process, we need to make sure that we've looked at this messy data middle. And oftentimes you'll see our core transactional systems working side by side, producing great results and insight, but not necessarily working together to provide that decision support and real-time decision support information. Instead, we have lots of Excel files going across the organisation, or we might have the federated data platform, which is looking at activity and population, doesn't necessarily link across with supplies or workforce or finance. So we still have disconnected. One solution is to look at a digital planning platform which sits in the middle and brings together this data into a data hub. is able to cope with large amounts of data, roll up and roll down, but as I say, across different lenses, takes different resource plans and knits them together, whether they be finance, HR, ops, etc. Tests, importantly, rigorously test those what-if scenarios. What if we change this assumption? What if we change that assumption? What impact does it have? And what impact does this decision have on another part of our planning system? And can we report adequately and forecast adequately from this planning system across all of these different lenses? And importantly, be able to report on all of those transparent assumptions right across our planning framework, and have great governance and decision making in place. So finally, the third step process speaks to this decision making, where we create dynamic continuous alignment. And if we imagine that we're in our new planning horizon and we're unlocking our plans on a monthly process and going through this dynamic assurance, we can automate some alignment here and look at how do we, first of all, take all of these initiatives that we want to launch or we've already got in flight, and we can understand what impact those initiatives have on our benefits. Have we stress tested those initiatives? Have we stress tested our transformation programs and stress test some of the core assumptions on demand, activity, productivity underpinning them? And then we go through our assurance process of looking at, for example, the finance plan and putting across it a series of tests related from the other plans in our system: workforce planning, activity planning, productivity and performance, just as an example. And what we'll have is a key set of indicators and assurance metrics here, which tell us whether they are in alignment or in misalignment between all of those individual elements. And we'll repeat that process for the workforce plan, for the activity plan, etc. Just running those overlays across each of them and looking for that alignment and misalignment. I think it's important that you're able to override those misalignments and say it's okay to proceed. But in the end, we need to be assured that the decisions we're making do speak from one plan to another, and that we understand the decision across the whole integrated planning footprint. And then we lock our plan again. So that then gives us a continuous alignment, assurance at a board level and at a department and at the shop floor level, that we have got connected planning and connected decision making that will make a difference to our patients, to our populations and to our wider stakeholders. Thank you.